Today's topic is gastroesophageal reflux disease, which is also known as GERD. It is due to an inappropriate relaxation of the lower esophageal sphincter, resulting in the acid content of the stomach coming up into the esophagus. Factors that worsen the symptoms of GERD are nicotine, alcohol, caffeine, chocolate, late night meal, and obesity. The various signs and symptoms are epigastric burning pain that is radiating up to the chest. Include are food regurgitation, which are exacerbated by meals, bending, a sore throat, bad taste in the mouth, hoarseness of voice, or cough. Symptoms for persistent disease may include odynophagia, dysphagia, weight loss, GI bleeding, chest pain, and anemia. Now, diagnosis. GERD is a symptom complex that is most often diagnosed based on patient history. In some patients in whom the diagnosis is not clear, 24-hour pH monitoring is done to confirm the etiology. Urea blood test, stool antigen test, and ECG is done. ECG is done mostly in old patients or there is a risk factor for coronary artery disease. And endoscopy is indicated when there is sign of obstruction, that is dysphagia or odynophagia. When there is weight loss, anemia, or heme positive stool, more than 5 to 10 years of symptoms. GERD may show redness, erosions, ulcerations, strictures, or Barrett esophagus. But endoscopy will not show anything when there is only heartburn. Now, management. General measures are lifestyle changes. Stop smoking, reduce weight, and have anti-secretory agents. Avoid alcohol, nicotine, caffeine, chocolates. Avoid eating at night before sleep within 3 hours of bedtime. Elevate head off the bed 6 to 8 inches. When there is mild or intermittent symptoms, then liquid antacids or H2 blockers are given. When there is persistent symptoms or erosive esophagitis, then proton pump inhibitors are indicated. Treatment for those who are not responsive to medical therapy. About 5% of GERD patients do not respond to medical therapy, so they undergo surgical correction to tighten the lower esophageal sphincter or nascence fundoplication, that is wrapping the stomach around the lower esophageal sphincter. Endocinch, using a scope to place a suture around the lower esophageal sphincter to tighten it. Local heat or radiation of lower esophageal sphincter causing scarring. If urea blood test or stool antigen test is positive, then go for H. pylori eradication therapy.